Welcome everybody to this session on care and care work, the COVID-19 pandemic, the limits of the market and the question of social responsibility. My name is Andreas Novy. I'm a socio-economist working at the Vienna University of Economics and Business, and I'm president of the International Karl Polanyi Society and will be the facilitator of this session that will have 75 minutes for this session. And we have three renowned speakers who will give a presentation of 15 minutes each. And we, Michael Fine, Brigitte Aulenbacher, Joan, Tronto. And we'll start with Michael Fine. He is not only honorary professor in the Department of Sociology at Macquarie University in Sydney, but he's also the hero of the event because it's 2:30 in Australia. I'm very happy that you are with us. He's editor of the New International Journal of Care and Caring. He's written several papers and books on this topic. Well known his paper on dependence, independence, or interdependence, revisiting the concepts of care and dependency with Caroline Glending, and more recently, the Marketisation of Care, Global Challenges and National Responses in Australia with Bob Davidson. We are very happy to have you here, Michael, and the floor is yours.
Okay.
Yes.
Thank you very much, Andreas. Good from Australia's point of view. Good morning. It's indeed 7 minutes to 3 a.m. in the morning. Look, we always start these sort of official presentations these days by acknowledging the traditional owners of the land. And I'd like to start that. Let me share my screen now, and I think I'm going to, there we go. Now we start again here. Okay. There we go. So now let me start back here. I'd like to acknowledge the traditional owners of the land, and their descendants. So what I'm going to talk about today is the impact of the COVID pandemic and the marketised economy of care homes, looking in particular at the data on the deaths in care homes, which internationally shows rather a disproportionate impact. And the question is why that could possibly apply. I'm also going to discuss in the process of doing that, look at the way in which care markets have become a keystone of policy reforms in liberal democracies. And I believe that it really helps us to look at this through a Polanyian lens, in particular looking at two particular aspects, the marketisation, which brings about issues of precarious employment, and we find it useful. I find it useful to be borrowing on Brigitte Aulenbacher's application of the concept of care as a fictional commodity. But I think that has a strong limit, and I'm going to discuss that also while I present this. And I think the second element I want to draw upon is the idea of the self-regulating market. And I think we need to, in a sense, almost update that by grafting into Polanyi's work. It's inherent throughout his work, is the concept of governance. And as we've moved to a market system, we've lost the sense of a central system which is coordinatable and manageable. And the complex governance means that the autonomy of the different providers has left responsibility for providing protection to the most vulnerable groups of the population, certainly in the era before vaccination, to residential aged care facilities. Care homes, as we call them, which are peculiarly poorly suited to providing that protection. And particularly in this era where there's been an attempt to move away, there's not only marketisation, but within that system, an attempt to try and move away from that model that was once known as in sociology as the total institution, towards a much more personalised care model, one that's based on domestication. I'm going to do that in particular by way of looking at the experience in Australia, which I'll explain why as I'm going into the paper before reaching my conclusion. So that's my outline. Let me see. Now here's quite a few statistics. There won't be a test on this at the end of the paper, but it's nevertheless quite complex to get your head around. But fortunately, I'm able to use the work of the International Long-Term Care Policy Research Network, which is based in London. And they've managed to keep going right throughout the pandemic. And they've been able to work through the inconsistencies and the poor quality of the data that's available. There's a lot of poor quality data. For example, a lot of people died particularly early on in the pandemic without having a clear diagnosis of why they were dying. Should they be counted as a COVID victim or not? The long-term care policy network has worked through a lot of those issues, and I've simplified this to produce this data. If you look at the central column in this paper, you can see the care homes deaths as a percent of the total. It's particularly high in Australia, particularly high at 75%. Early on in the pandemic, countries such as Canada had over 80%. That really drew my attention to it, watching the statistics and seeing that it was just so high in Australia, but so high in Canada. But Australia caught up, and fortunately we were very fortunate that in general the public health measures taken in Australia kept the pandemic to or had a minimum impact compared to at least many countries. So we had very relatively benign conditions, and you can imagine with 75% of the deaths in 75% of the deaths in Australia in care homes, if we'd have focused our attention on protecting care homes, we would have really reduced the pandemic to very, very minor precautions. As it was, of course, it's had a massive impact on our lives and business, and of course, many people, including those in care homes, have lost their lives. But right throughout the world, a very disproportionate amount of the death that we've seen has been due to the deaths in care homes. And that's what this paper addresses. How could that be in these institutions that were deliberately set up and have been funded for the last 40, 100 years in some cases, been set up for so long? Why is it that over 41% it's the international average, 41% of the deaths were in care homes? You can see that this has been the case. Now, this diagram on the right actually shows a slightly different perspective. This looks at the percentage of the care home population where death was attributed to COVID-19. So some countries, such as, well, in this case, look at New Zealand, Singapore and South Korea, only a tiny percentage of people in the care homes actually died. Australia, it's larger, but in some countries, almost 10% of the population of care homes died. Now, it's often sort of shrugged off. You know, older people are more vulnerable to COVID. Therefore, mortality rates increase with age. Of course, it's occurring in residential care, but it's much higher. The rates in residential care are much higher than in the community, and the epidemiology of dependency, of a need for care and need for support, just doesn't support that conclusion. And I'll look in a moment just at some of the epidemiological accounts as to why this might have occurred. What that suggests, in short, is that really there's been a policy or a commercial market failure. Somehow or other, these failings cannot be attributed simply to the epidemiology of this care. Now, I don't have time to go through the literature. There is already quite an amazingly rapidly developed literature, as you might expect. perhaps the most simple way to do it is to discuss a review of 30 studies from the United States that was produced by the KFF, the Kaiser Family Fund. And they looked at over 30 studies fairly deeply. I won't go through the whole lot, but what they call the key takeaways, the key messages were that they found that clearly, as many of the politicians were saying, as a sort of trying to shrug off public responsibility for a better public health intervention, the prevalence of COVID-19 cases in the community is consistently associated with deaths in long-term care facilities. And we see that same wave of deaths that are going through and same wave of prevalence that we see in the community. We see that reflected in residential care, but then exaggerated because of the effect, the concentration effect and the cross-contamination effect that we see within residential care in settings. Staff infections appear to be the link between cases in the community and long-term facilities, despite the emphasis on families being dangerous and the need in most countries to keep families away from their loved ones in residential care facilities. Interestingly, in the United States, and I think this is something that we find in most countries, long-term care facilities that are for-profit or have higher shares of residents who are people of colour, in other words, we might also generalise that, who are from low-income backgrounds or socially disadvantaged backgrounds, have higher rates of COVID. And interestingly, nursing homes or residential care facilities with higher staffing levels have fewer cases of deaths in the family. That's also higher quality staffing, and higher quality is becoming increasingly important in this area because one of the budget mechanisms that has been introduced around the world under marketised services is to reduce the qualifications of staff. There's been a de-skilling procedure. So the quality of staffing, I don't mean quality in terms of the quality of their character, but the quality of the depth of their knowledge, their understanding of clinical process and so forth has been massively reduced over the last 20 to 30 years in most countries in the world. Now, I'd like now to just turn to discuss briefly Polanyi, and I think I can assume that most people who are listening have a pretty good working knowledge of Polanyi, but let me just try and apply this to this topic. Historically, we know that the rise of public policy, which has been so prominent in the development of aged care and indeed age pension system, was because the market fell. We needed homes for the poor. We needed that already back in the 14th and 15th and 16th centuries. We saw a welfare response developing through things such as direct charity and poor law homes in Western Europe, right from the 13th and 14th centuries, particularly rising in the 16th, 17th, 18th century. By the 20th century, we start to see this developing further to become much more welfare state programs. Now, welfare state programs, we often sort of make an exception, I'm sure you know, for the United States, but it's in the United States that we did see, particularly under the Kennedy administration, quite an extensive expansion of the welfare state through Medicare and Medicaid. So we've seen welfare state taking on the aged care responsibility very directly, often with inconsistent levels of care between different types of homes, but nevertheless there were welfare state programs in all the industrialised welfare capitalist countries. Interestingly, in the last 30 years, we've seen a lot of introduction of markets, and it's very reminiscent of Polanyi's description of the introduction of markets in the 19th century. These weren't natural markets. These were very much introduced by governments in the late 20th and early 21st centuries. So markets were not in aged care in particular, but I think that Polanyi really draws your attention through his detailed historical work to the way in which the markets in general were not natural, self-regulating or open. In particular in aged care, we can document the way in which these markets are planned and they're regulated markets, and their development has been justified. We can, many cases, recall the speeches, we can recall the reports and the legislation that justified the market as more efficient than direct public provision, that introduced this as an increase in choice for consumers, that would introduce flexibility. So it was justified, initiated, subsidised and funded by the state, but the markets nevertheless is the rhetoric in which they're and not merely a rhetoric, it becomes an administrative framework through which aged care is now operated in right across welfare capitalist countries. Polanyi's approach, I think, therefore, clearly represents a good sort of approach to understanding the way in which markets are affecting provision of aged care. So I'm deriving two hypotheses that I'm, in a sense, going to explore. I can't say I'm giving them a rigorous test today, but I'm going to use the test to illustrate the power of these hypotheses. And the first is that we see a reliance on precarious, low-paid labour of direct care workers, who are the source of contagion, as it were, raises questions about the way in which care has become a false commodity, as Brigitte Aulenbacher and some of her colleagues have been arguing. But Brigitte is particularly eloquent about this, and I would recommend anybody interested in this topic in following up her work on this. And secondly, I'd like to look at the question of the reliance on market mechanisms of self-regulation for provisions. And this is where I believe that the concept of governance helps us much more than we might have had. So we look at the way in which the forms of governance under the market has destroyed the capacity of the larger system of specialised facilities and organisations to operate as a coordinated whole. This sort of top-down perspective helps us to see that we've tried to contain, in some senses, it seemed to be almost universal, contain the problem of COVID contagion within care homes so that we could maintain public hospitals and indeed the whole medical system without being inundated by a tsunami of old people from care homes. We've lost that, and we've left the responsibility in the hands of these institutions that are incapable of managing it. And this emphasis, the second component of this second hypothesis, is that there's an emphasis on the business autonomy sort of meshes with the organisational closure that occurs around a home, which is an enclosed environment with a board of management or a managerial company which is held responsible. And this is sort of further served to isolate the residents and staff. And it's resulted, particularly during the pandemic, with the return of this residential institution, which is very reminiscent of what Goffman once described as the total institution model of care. I'm now going to turn to the Australian
15 minutes already. Michael, you have 15 already.
I have 15.
No, you have talked 15, so your time is over. So try to summarize it as best as possible.
Yeah, I'll be very quick. We had an aged care roadmap which pursued in 2016 was pushing us down the line of a consumer-driven, market-based, sustainable aged care system. This was the slogan that was really driving aged care reform in Australia. The truth is that initially, we had two waves of COVID in New South Wales. Fairly quickly, they managed to get on top of it with the state government, not the federal government, who's responsible for aged care policy, actually intervening. This learning was not passed on to Victoria, where we had the bulk of our deaths, over 90% of the total deaths of care home residents. And we can see the problems that emerged in a number of reviews, including from the Royal Commission report, which I just showed, independent unit care homes were poorly equipped. The highest death toll, however, wasn't just in for-profit homes. So I don't think we can just follow that simple sort of gut feeling that the for-profit was the problem. Marketisation means that non-profit homes start to operate in the same way as for-profit homes, and over 50% of our homes in Australia are still non-profit. The highest death toll occurred in a home run by the Greek Orthodox Church, and many other non-profit homes also had very high death rates, including those in New South Wales. Precarious employment of care staff, where many people had multiple part-time jobs working in different homes, came up. Limited public health response, as they weren't responsible and they were managing the hospital, the public health. And the federal government, who should have been intervening to sort this out, as eventually it happened in New South Wales, refused to become involved. The evidence suggests the Australian government did not learn sufficiently from this experience. Let me finish very briefly. I think we can see that both hypotheses are somewhat held up by this case study in Australia. I think that turning to this question of social responsibility, I think that we have, in a sense, in Polanyi, not simply an analytic system, but we also have a holding up an ideal of a better democratic way through to collective survival. And I think he fosters a respect for governance based on democratic participation. And I think indeed that we see through the collective action that was necessary for us to get through the pandemic, we see an opportunity for democratic social learnings. But I think there's a fear that I have that we're going to expect somehow this to be a spontaneous double movement, that the people are all going to realise that somehow or other we are much better off collectively. Now, fortunately, Biden has really shown that good can prevail over evil, but I think it's not something that we can expect automatically to occur. I've left other results on the screen. I'm sure you've heard me say them. I think that the Polanyi offers us a real insight into what's happening, as well as an inspiration into the way through this. I'll finish then. Thank you.
Thank you very much, Michael.
Good. My apologies. I was so worried getting my paper up.
We have 50 minutes more, and you just perceived this and calculated it in. Our next speaker is Brigitte.
Oh, okay. All right.
Our next speaker is Brigitte Aulenbacher. She's professor of sociological theory and analysis at Johannes Kepler University in Linz, vice president of the International Karl Polanyi Society, co-editor of Global Dialogue with Klaus Dörre, the magazine of the International Sociological Association, and over the last years has published several books and papers on Polanyi, capitalism, transformation movements and counter movements in the 21st century, and what the book we just presented, co-edited also, Karl Polanyi, The Life and Works of an Epochal Thinker. Brigitte, the floor is yours.
Thank you very much. I have a little problem to start my presentation. Also, it should work now, so fine. Yes, thank you very much for this invitation. I'm happy to present some thoughts about the relation of COVID-19 and care and the market society in the machine age. And I'm really happy that Michael has presented all these very important empirical findings from long-term care facilities, because I'm more theoretical speaking about this situation. And it's, of course, very interesting to have both in the discussion, the empirical findings and interpretations, as well as the theoretical ideas. So I will start with this 3 points. First, I want to talk about fundamental tensions between care, modernity, and capitalism in a sense of what is the problem. And then I want to talk about the COVID-19 pandemic and the pandemic and its causes, as well as the pandemic and the care sector. And then I want to conclude with some ideas for the discussion after the pandemic, back to normal care and the economy. That's the program I suggest. So first, the fundamental tensions. In many countries, also in Austria, there has been a lot of new public recognition for care. In the pandemic, care workers had a lot of unprecedented attention in form of public applause, television interviews, bonuses given to them in working in hospitals, in care homes, in private households, because they continue to care for others despite the risk for their own self-care in terms of health risk as well as poor working conditions. And the question is this just a one-off that will be forgotten as quickly as it arrived, or is the pandemic a warning sign or wake-up call that the market society and the machine age have reached the limits of human life? Or does it open a window of opportunity for rethinking about the responsibility to provide care? And I would like to start with some thoughts about the relationships between care and modernity and capitalism. I make that really short. First, let us explain what is care. My definition of care is these are the relationships, the activities, and all forms of labor dealing with the contingency of life. Life is uncertain, life is vulnerable, and people need in everyday life and in the whole life course care to be cared and to care for others. Care in this sense is a prerequisite for life and survival, and like labor, a species activity of humans as social beings. Humans are reliant and dependent on one another, and they need to care and they need to be cared. John Tronto calls it homines curans. Self-care and care relations and care as relations with the self, between the humans and the non-human natural world, all this is care. So in utopian understanding, care serves the social ecological preservation of life for its own sake and not for other purposes. And that's the problem. In modern and capitalist and industrial societies, care is subordinated to other purposes. So let us have a look on what is the specificity of the modern industrial and capitalist understanding of progress. This society also deals with the contingency of life, but seeks to control it through scientific and technological means. Modern concepts of humanity or the modern idea of man is not the idea of a dependent human being. It is the idea of the capacity for self-care of the autonomous subjects and the independent individuals. In the words of Polanyi, improvement, not habitation, is the primary aim in accordance with economic imperatives in this society. And this is what I call structural carelessness of capitalism and of the market society. This society abstracts from human needs, or it considers human needs, but only in a functionalizing or valorizing way. And we are witnessing functionalizing and valorizing of care and care work. Michael has described a lot of moments of these kinds of marketization, instrumentalization of care and care work in the field of long-term care. So what happens in the pandemic? If you have a look through the lenses of Karl Polanyi, then two concepts are of interest. First, his description and analysis of the industrial age as market society. We all know the core elements of his idea of the market society. He reconstructs the implementation of the liberal creed in the industrial age in combination with the notion of the self-regulating market as the economic principle corresponding to the idea of man as homo economicus, not as homines curans, and primacy of the market economy over all other economic principles. So this includes that all elements and all production factors have to be included in this kind of market exchange, all including those never produced at all or intended as objects for trades, land, labor, money, and I'm adding care as fictitious commodities. And this commodity fiction and this kind of commodification is destructive. And we see if market exchange entirely bases on supply and demand and the signals of price, costs, and profit, then Polanyi described it will lead to the demolition of society. He described this as, and this citation, as a kind of satanic mill. This is the history of the market society. The second story he is telling us is his reconstruction of the machine age. And both are interrelated, both are interconnected. And his description is a description of the changes going along with scientific technological development related to the market society, and which also harbors destructive potential. He tells that the fundamental fact is then that the machine created a new civilization, and the industrial civilization, it spread over the planet, creating the perspective of the ages to come. Such an event transcends by far the economic field. Only time will unfold its powers and perils and spell out its implications for the existence of man. We see that the machine age is really important for Polanyi's analysis of the industrial age, and because it affects the interpersonal relations as well as the whole existence of human beings. So what has happened in the pandemic? I want to talk about two aspects. One aspect is the pandemic, its causes and the fight against it. And in this way, I want to explain the pandemic as the result of the market society and the machine age. Polanyi's question, most important question from my view, is how can humankind survive the industrial civilization? And the pandemic we are witnessing now is a civilizational catastrophe caused by, from my perspective, the careless treatment of the very foundations of social ecological reproduction. the emergence and the spread of the SARS-CoV-2 virus is caused by a so-called zoonosis. It's linked to the disregard for social ecological care requirements in the context of the commodity fiction. In words of Polanyi, nature would be reduced to its elements, neighborhoods and landscapes defiled, rivers polluted, military safety jeopardized, the power to produce food and raw materials destroyed. I remember to all the things we are witnessing and experiencing in this pandemic. The causes of the pandemic, from my perspective, are the technology-based, finance, market-driven global economy, because it diminishes the habitat of wildlife, facilitating the transmission of the SARS-CoV-2 virus and producing a lot of social inequalities and vulnerabilities around the globe by the destructive commodification of land, labor, and money. On this conference, we often have talked about global inequalities in face of the pandemic, and I think the commodification of land, labor, money is part of this production of inequalities. And the fight against the pandemic, notwithstanding that we are witnessing a lot of counter movements like Fridays for Futures and many others, the fight against the pandemic is more or less in line with the machine age and the market society. We have public funding by the state for scientific and technological research, not at least the research on the vaccination. And we have the strategy of inoculation and tests, and we have huge market creation instead of the accessibility of the vaccine as global public good or commons. BioNTech Pfizer has a wonderful address in Germany at the gold mine. And it's indeed what we can see. It's a kind of gold mine, what happens in this politics of inoculation. But the pandemic is not only caused by the market society and fighted against by the machine age. The pandemic also affects the care sectors. And the care sectors since the 17th are to be described like Michael has done it. There is a strong tendency towards marketization, technologization of care and care work, combined with the declining responsibility of the state and changing relevance of family, community, and individual care. After the crisis of finance, supra and supranational, international austerity schemes had a major impact on the public care sector. So since 10 years, we are witnessing a lot of care and labor disputes, a lot of care protests in the sense of Polanyian counter movements in face of the commodification of labor and care in the care sector. The care sector in childcare. I have 2 minutes.
Yeah.
I have 2 minutes, Andreas.
Yeah.
Okay.
All right, but I just need to you can extend a little bit, but you're only with 2.2. If you go beyond 2, that's very fine. Go ahead.
I still have 2 minutes.
You have
okay.
2 minutes.
Yes. Care and labor disputes in the last decade have have taken place in childcare facilities, hospitals, nursing homes, and so on. And the problem has indeed most of the problems have been focused on marketization of these care facilities. So the pandemic comes along with additional requirements and drives these sectors to their limits. So the question is this a window of opportunity and a turning point towards new care responsibilities in face of the social ecological care requirements? And Polanyi, for Polanyi, I have put down 3 very important statements. For Polanyi, the self-regulating market is the most important problem that we have to resolve. Then he thinks we have to deal with the machine age. It's our fate. It is our fate. We must learn to live with it. And last but not least, in case that we can end this blind improvement in favor of habitation, then the industrial society may be just and free. So the tasks, and that's my conclusion, the tasks would be to subordinate industrialism to social and ecological requirements, to put the economy back in its place in society and the market in its place within the economy. That's what we can learn from Polanyi. And his idea is to transcend the commodity fiction and to make use of planning, regulation, and control as appropriate means instead of the market-driven organization and technologization of care. So my 3 conclusions are, first, the current visibility and symbolic recognition of care work as essential can be opened in the sense of a window of opportunity to emphasize the significance of care. Second, the experience of the pandemic can be a turning point towards new collective care responsibilities instead of the market-driven organization and technologization, if we can and are able to discuss about collective responsibility and new forms of care infrastructures. And the third and last point, the turn of the corona crisis into an economic crisis can be a starting point to rethink economy in the light of human needs. So we can relate state and political interventions to the social ecological transformation of the economy, and therefore initiate a shift from improvement to habitation and from market society to careful society. Thank you very much.
Thank you very much, Brigitte. Thank you very much for your presentation, and thank you very much for this hopeful hopeful ending. We're showing some positive potentials in the current situation. And we come to our third speaker, Joan Tronto, Professor Emeritus of Political Science at the University of Minnesota. She is initiator of the Care Ethics Research Consortium and known for several publications on, in the field we are discussing today. Probably most important, Caring Democracy, Markets, Equality and Justice from 2013. And we are very happy that we have you here on this panel. The floor is yours.
Thank you, Andreas. Thank you to the organizers of the conference for inviting me to participate. I'm very excited to be talking today about Polanyi and the COVID-19 pandemic. I mean, the issue that we have to ask was, Brigitte, it really leads into the talk I'm going to give, because I want to take it from the point she ended and go a little further and ask, how do we get there? How do we get to this change that she's talking about? Look, there have been other zoonotic viruses that have been controlled. So what is it about this virus that turned it into a global pandemic of such awful conditions? Perhaps something that has to do with neoliberal economic policy has to do with this, as Brigitte has just very well argued. But I want to focus on one piece about what comes next, which is how do we make it possible for people to, as Michael suggested, it won't happen spontaneously. How are we going to change from where we are to where we want to go? And this requires us, I think, to go back to the exegesis of the relationship of freedom and responsibility in the Great Transformation. And from there, perhaps, to turn to feminist rethinking of responsibility as a way to move forward. I want to look at a very long passage from the text because I think it's really important. The radical, this is towards the end of, and it's in the last chapter, almost the last page. The radical illusion was fostered that there is nothing in human society that is not derived from the volition of individuals and that could not, therefore, be removed by their volition. Vision was limited by the market, which fragmented life into the producer sector that ended when his product reached the market, and the sector of the consumer, so producers and consumers, for whom all goods sprang from the market. The one derived his income freely from the market, the other spent it freely there. Society as a whole remained invisible. The power of the state was of no account. He goes on. Neither voters, nor owners, nor producers, neither consumers could be held responsible for such brutal restrictions of freedom as were involved in the occurrence of unemployment and destitution. Any decent individual could imagine himself free from all responsibility for acts of compulsion on the part of the state, which he personally rejected, or for economic suffering in society from which he personally had not benefited. He was paying his way, was in nobody's debt, and was unentangled in the evil of power and economic value. His lack of responsibility for them seemed so evident that he denied their reality in the name of his freedom. I must say, I've been thinking about this passage a lot, thinking about people who refuse to wear masks because it restricts their freedom, and wondering why they haven't read Polanyi. So let me talk about the relationship of responsibility to freedom. I think Polanyi observes this incapacity produced by this distorted account of freedom. It is parallel in a way to an important point that stops me every time when I think about Hannah Arendt's Origins of Totalitarianism, in which she wrote, "Tribalism and racism are the very realistic, if very destructive ways of escaping this predicament of common responsibility." Now, it's this question of common responsibility. How are we to think about ourselves as responsible together? That is at the heart, I think, of somehow managing to reconcile what people will take as freedom, especially after they've lived in a market society, to being more responsible. And it is also parallel, I'll argue later on, to what Sheldon Wolin has called a managed democracy. So Polanyi himself recognized this and actually talked about it as a dilemma, because the first choice that he spelled out was the choice between freedom and fascism. Either you believe there's a society, in which case he says you become a fascist, or you're a liberal and believe there's no such thing as society. But the second version, which comes up at the very end of the text, allows him to say that accepting the reality of society leads to either fascism or socialism. So socialism then becomes his alternative, which he languages upholds the claim to freedom in spite of it. That is, in spite of the reality of society. It's this in spite of it that I think we have to somehow figure our way out of. I think Polanyi is right that there are ways to think of society and of collective responsibility and of being free in that situation, and yet at the same time to be free. So I'm going to suggest that feminists rethinking responsibility provide us with a way by moving care to the center of human society to make freedom more compatible with society, and thus to escape from the dilemmas that we see and to move in the direction that Brigitte was suggesting is a hopeful possibility at the end of this pandemic. Responsibility, the work that's been done in the last generation suggests, is a really complicated idea. It grows out, the very word itself grows out of the English word response. There's always someone else involved in a responsibility. It is not a synonym for obligation. which we think of obligation as something more abstract, something contractual, something that comes out of a duty. It is necessarily relational. And whenever we talk about responsibility, we have to ask to whom, in what ways. Responsibility always requires an ability or power to accomplish the ends to be achieved. And in this regard, it's both future-oriented and based on a past. And in terms of care, one can only assume responsibility having recognized there's a need and having some capacity to address the problem. So we go back to the discussion that Brigitte introduced about needs. So Margaret Walker put it nicely in her book, Moral Understandings. An ethics of responsibility as a normative view would try to put people and responsibilities in the right places with respect to each other. Iris Young, many of you are probably not familiar with the feminist literature here. I want to emphasize how many different versions of accounts of responsibility that might be useful for us to think about our sociological framings would come out of this existing feminist discussion. Iris Young, in her social connection model of responsibility, argued that our wishes, actions, general orientation toward the world begin to shape the complex web of relationships in which we generate responsibilities. And our responsibilities for her change shape depending upon where they are and how they exist in the world. Now, this model of responsibility that Young talks about allows us to see the agent structure model of typical social theory and to see the prospects for agency differently. Young's example is interesting. She started with the kids who were arguing that the hoodies and other sweatshirts and other clothing that they bought that bore the logo of their university, very big business in the United States, was being made in sweatshops around the world. And they began a movement about this. And of course, many leftists said to them, oh, you silly children, you're just playing with yourself. That's not the real issue of what's wrong with capitalism. But Iris Young said, no, actually, they should start right there. That's where they are, and that's where you should always start. All of us have deep webs of responsibility. Nobody probably is irresponsible for any problem. But as these problems become more and more complex, we have to recognize ways to assign responsibility, to go back to Walker's phrase, and to see just how much responsibility you bear when you buy a sweatshirt that was made in a sweatshop, for example. Now, this, I think, also is parallel to the argument that Sheldon Wolin made in his book, Democracy, Inc., Managed Democracy and the Specter of what he called Inverted Totalitarianism. He argued that managed democracy permits no control or power for individuals, and without any power, people have no responsibility. Without responsibility, people have no sense of a need to participate in the kind of intermediate institutions, to use Tocqueville's language, that work against and can become the source of counter movements. And if all of that begins to fade away, people are left in a very precarious position of trying to think their way out of knowing that they're powerless, but thinking maybe they have responsibilities. But if you don't have power, then the way to deal with that is to deny the responsibilities you have. Since assuming a responsibility looks like a risk, people deny that they have a responsibility at all. So let me spend a minute talking about getting real, about care responsibilities. I begin by quoting my dear friend Machiavelli. Men in general judge more by their eyes than their hands, for everyone can see, but few can feel. And I use this quote, somewhat out of Machiavelli's context, to be sure, but I use this quote because what care can do is bring us back to the reality that we do know how to accept, assign, assume, deny, change our conceptions of the responsibilities we have. People do have these common experiences of accepting or shirking responsibilities, and care involves us in concrete judgments about needs. It provides for us a way to talk to strangers, to use Danielle Allen's phrase. And we need a political discourse then that builds upon this experience. In Caring Democracy, that's what I argue we need to do, is to start to think about all of our political disputes in terms of what do they mean in terms of care. So I want to switch the political economy on its head and say what we really need is care. And the economy's purpose is to serve the interests of care, and we can figure out a way to do that. Now, Stephanie Collins, in her short book, The Core of Care Ethics, used this phrase to define what it is we do. Dependency relationships, she says, generate responsibilities. And we can just start there. People have responsibilities to others around them. People have responsibilities at least to their families, to the people who raise them, if no one else, to the people they're raising, if no one else. And as we begin to think in concrete terms about care, people's levels and relationships and webs of responsibility can become more concrete. Taking care of others teaches people that responsibilities have consequences. And insofar as we've begun to recognize in the very littlest bit how seriously we need care in the world today, this is a consequence of what's happened as the pandemic has exposed who are actually doing essential work, who are actually doing the hard work that needs to get done in order for society to cooperate. It's not the people making millions in finance, it's the people who are delivering that food you order to your door, putting themselves and their families at great risk. So this politics of accepting, denying, changing, and judging responsibilities occurs in everyday life, but it's also a way to describe what occurs in politics. And if we were to manage to change that description in politics so that it aligns more closely with what it is that we do in everyday life, then it will be possible for people to see that they do have some power to make political change through democratic institutions. If we accept the responsibility for democracy itself, it requires us to act more democratically. That is, to reduce hierarchy, to widen our power bases, and to be more inclusive. Polanyi's stark alternatives then can be moderated by the everyday lives of care. Though choice doesn't have to be, as he suggested towards the end of the Great Transformation, a choice between fascism or socialism if we recognize society, or neoliberalism if we reject society's reality. But we do have to pay more attention to the centrality of care in human life as the model of how humans interact in society. To do so is to see that humans are best understood not as Brigitte has already said, homo economicus, but as homines curans. Thank you.
Thank you very much. I was just typing 2 more minutes, but you were, it was not necessary. Thank you very much. Yeah, can the others also put on their video? We are coming to the end of the conference, and I perceived I have not remembered all of the audience that you can ask questions in the Q&A section, but I've looked up those participating and they are all experienced conference participants. So you're once more invited to ask questions. We don't have any questions yet, which means that I hand over to Michael, who has to give a first. We are 13 minutes from 8 o'clock. It might be that my original plan works out like this, that Michael, I hand over once more and probably for the last time the word to you, kind of reflecting to what you heard from Brigitte and Joan and to enter in a dialogue. And if in the meanwhile a question pops up, just include it. Yeah? So you have, if I divide the remaining, so some 4 more minutes. Yeah.
Okay, good. All right. Well, what an honour to hear such fantastic papers from Brigitte, Aulenbacher and Joan Tronto, and what an honour to participate in a session like this. I think that while I was hurried, I think that my contribution highlighted how it Polanyi's work provides us with a strong research hypothesis and a strong research analysis that's powerful. But what I found particularly inspiring from Brigitte's and Joan's contribution was how this provides us also with a orientation to understanding our place in the world and our sense, as Joan was putting it, of our responsibility for responding. I think that she's completely right about care being an immediate responsibility that is an experience we all have. We have that experience receiving it as a child. That's universal. We all require care. And we have an experience throughout our life of requiring it from time to time, care no matter what our health is. But we also have that responsibility to provide it. And that's something I think males need to be encouraged to accept, and many do, but it's something that we need to extend. And so that's very powerful. I found Brigitte's analysis of the machine age component of Polanyi very inspiring also. And I think that this is something that I would hope would become more possible to share as part of our sort of general discourse. And perhaps that's something that we do need to think about, just the general utility of the application of Polanyi's work to both care, but to our general human dilemma of existing on a planet that threatens to destroy ourselves, destroy the very nature in which we depend, and destroy the very people that we share our lives with and on whom we depend too. What you can't help is towards the end of the conference. Why is it that this dialogue has become so marginalised of recent years? How do we start to resuscitate and reintroduce this back into our normal discourses of humanity? It's been many elements of this anyway, were part of religious discourses and of political ideals. As we start to once again be inspired by ideals, I have a hope that we can start to conduct these conversations more than just in highly specialised Zoom meetings and conferences where only a small elite get to participate. How do we get this in particular for me, into our social democratic discourse and beyond the social democratic discourse into the public discourse? I found the talks that I participated in today really inspiring in that, and so clarify for me just the power of this sort of analysis.
Thank you very much. Before I hand over to Brigitte, a comment by Margie Mendel arrived. Thank you all for this excellent panel. For Joan, Polanyi's concept of freedom is associated with responsibility. We cannot conceive of freedom otherwise. This is in the last chapter of The Great Transformation, as well as in early writings on freedom. Thank you again. I mean, you cited from the last chapter. So, Brigitte, you can take up on this or on other inspiring aspects of the talks.
Or should I? Would you like to answer, Joan, to Margie? That you answer first, and I take the third part.
Sure. And I want to echo Michael that it was just wonderful to hear both Michael's talk and Brigitte's talks, just really helpful and wonderful views of this. Now, Margie, you're right that freedom and responsibility are connected in the last chapter, but they're connected in a very strange way. I reread that chapter a lot of times, and his conception of freedom is very individualistic. It's very much based in religious values. It's very much based in Western values. And he keeps repeating, this is universalistic, this is Christian, this is... So in a longer version of this, I would obviously spend more time unpacking his idea of freedom. The kind of freedom that I'm talking about that connects to responsibility in this way isn't for Polanyi, as for most 19th century thinkers, there's something almost automatic about this process of, I understand this is what my freedom is. I understand these are my obligations. Let me use that language instead of responsibility. And therefore, I'm not unfree if I meet these responsibilities. But that's not how it actually works, as Walker suggests. There's an ongoing negotiation about the meaning of responsibility. And the task of freedom, it seems to me, is to have enough capacity to be able to see and participate in that process of figuring out what your right responsibilities are, making hard decisions in your own life about who to care for, how to care for them, when to back off, when to contribute more to the collective good, when to say that your freedom has been infringed, changes under those conditions. So that would be my answer to that. You're quite right. I didn't do it the discussion justice in this very short presentation, but I think there is something kind of, an old-fashioned freedom is very stuck in a particular place in relation to responsibility in Polanyi that I'm trying to unstick in a way by using the feminist process ways of thinking about freedom. Thanks.
In the meantime, there came another comment by Marci that connects very well to Brigitte answering in a second. Will seeing care workers is essential during COVID make a difference? In Quebec, this has generated important discussions and results. Recognizing the need to support home care workers, for example, as this will allow elderly people to stay at home and so on.
Yeah.
Yes, thank you very much for this question. And before I answer this question, it's a great honor and pleasure to discuss with Joan and Michael and Margie and in our round. And I'm really happy to have this opportunity to do this. And the question of Margie fits very well with the presentation of Michael. I have learned in the presentation of Michael that we have a double problem. The problem of this market fundamentalism in the care sector and the marketization of care goes along with the destruction of care as well as with the destruction of labor. So we have a double situation in the care sector, no decent care and no decent work. And this is deeply anchored in the social or the society's concept of age. Michael already described it. One of the strategies is to isolate the seniors. In our performance-oriented society, best agers have their place, but the so-called fourth age or the multi-morbid persons, there is isolation the strategy. And those care workers who are working in long-term care are indeed care workers with a very low recognition of their work, of their hard work in these long-term care facilities. And this is what Joan also said in her contribution. We have to rethink care and economy. We have to rethink economy in the sense of it serves care, it serves livelihood. This is the purpose of economy and not otherwise around. And yes, Margie, we have the same situation in Austria, but combined with a lot of symbolic policies. Just to give an example, when in some long-term care facilities have not been able anymore to care for some of the people, so they went home and they ordered a so-called live-in carer, 24-hour carer. And these migrant people from Eastern European countries received a bonus of 500 euro for staying in Austria, and for staying in Austria also they had family needs in their own countries. And many of these carers have said that they don't want to have this bonus because it's ridiculous. Of course, many have taken it because it's better than to have nothing. But many of them also told it's ridiculous. And on the other side, we had a lot of new progressive discussions on the recognition of care too. We had both symbolic policies and emancipatory discussions.
We have more a statement than a question, but it might stimulate some of the three of you for a final word by Francisco. Freedom gains with responsibility, and collective responsibility and justice together with equality. My final word, before I would very much appreciate a final word from your side. My final word is definitely that I'm honored and happy that I facilitated this session that was really inspiring and insightful. Also, after a long day, it's evening here, Michael. Yeah, any one of the three of you who want to have a final concluding sentence or remark?
Well, look, I mean, it's a profound thought, and thank you, Francisco, for sharing that with us. You're quite right. There is a profound thought, but there is also a common response to where we articulate that, and that is my freedom ends where it starts to affect another person's well-being. You know, if an action that I take harms another person, then I don't have the freedom to undertake that. And I think that was something that watching Trump, for example, and watching the Trump supporters believing that they have an absolute right to behave in a way which endangers the population massively was dreadful. And what I missed was a public response explaining to them in language that they might understand. But I think people do understand that you do not have the right to harm others. Just the same way as we don't have the right in a democracy to have a majority of people take action against a minority. There was no right to, for example, kill Jews or deny or hold slaves or all these things in history. There are points where we need to understand the limits of this freedom. And I think there are common explanations. That's one. But I think we do have to start to articulate that. And I think Joan and Brigitte have brought out why that's important.
Thank you very much. There's just one last question that I directed Marci. Will the slides be available if they are made available? Yeah, we will check this, and all the conference participants will.
Yeah, Margie, I have the question too. I missed quite a few of the sessions because just at the time that the conference was available. Will the recordings be available?
Yes.
If they are available, then the slides are automatically available.
Yeah, they will be available for the conference participants and probably afterwards for the general public. There will be a two-step process.
Excellent.
So I think I have to end because the organizers want to continue with another session. So thank you very much for the audience and the participants, and perhaps we meet at the final session, conference ending. Thank you very much.
I hope I've got the stamina. Thank you.
Thank you.
Thank you, Joan. Lovely seeing you, and Andreas. Lovely meeting you. You did beautiful sharing. Thank you.
Thank you.
Thank you.
Goodbye.